Okay, well, thank you all for joining our policy briefing today. We're really happy to have State Representative Farrar, who's the lead on this bill, to help explain it and answer your questions before the public hearing on Tuesday. And we hope that all of you will submit testimony, sign up to testify, and if you're able, come up for a press conference on Tuesday morning. So without further ado, I'm going to hand it off to Representative Farrar.
Thanks, Meryl. Thanks, Vanessa. Great to be with you all this afternoon. I know that you all could probably think of many things to be doing on a Friday afternoon, and so I'm super glad that we get to spend our time together on something I know you all care a lot about. And I would just say, for me personally, in being a legislator working closely on this bill with so many of you, you all are the experts. You're living this day in and day out. And so I do look forward to your questions. And as Meryl and Vanessa said, your valuable testimony. And more than anything, this bill and the governor's bill to really put forward his ideas around pre-K. I think both of them acknowledge how much more we need to do to invest in early childhood care and education in our state. And I hope that more than anything that comes through. And I think, walking through what is in 5003 today, I hope that you see that there is a bit of a focus on a lot of the needs that were particularly highlighted, not just from you, but in the Blue Ribbon Commission focus on infant and toddler care, and that those needs around infant and toddler care that we've heard a lot from parents continuously. But again, I think it's a good thing that we have so many of us talking about the need to invest in early care and education. And I hope that you all just see this as a next step in us coming up with how we can further invest and make this system that you all care about and work in so much better. And all of this is a work in progress. This bill, as was shared, is going to be heard next Tuesday. And it really is just the starting point of what we work on together this session. And I really look forward to that work with all of you. So thank you in advance to you being here, to being engaged, and again, for your expertise in this work together. So I'm going to be asking Vanessa to advance the slides for me as we go through. And again, the point of our conversation today is briefly go over what's in the bill currently and welcome your questions on it before we get a chance to hear from you all more next week in the hearing. On that note, Vanessa, I think I'll just say we can start going ahead. Awesome. Thank you, Vanessa. So what we're going to do with our review is we're really going to go section by section in House Bill 5003. I do want to comment that this bill is called 5003 for a reason. It's because it is a House priority bill. That means that in the House of Representatives, the Speaker of the House, Matt Ritter, often chooses several bills that are deemed as his priority and therefore House Democrats' priority. And that is the case for this bill this year, very similar to what 5002, which was on early childhood last year. So it really is a continued recognition of this being a priority for the House Democrats and our caucus. What you'll find in section 1 of the bill is a step forward in investing in the Early Childhood Care and Education Fund. This was something that we set up together in law last year in 5002. And this Early Childhood Care and Education Fund in this bill uses a surplus from the general fund. And the way that it is structured, the funds are in this fund and outside the spending cap. And as was noted on a couple other places in this bill, all of the references are to the Early Childhood Care and Education Fund that is currently in statute from last year. Next slide, Vanessa. So in regards to the management of these dollars, Again, this was in statute from last year. It allows the treasurer to invest these funds as they see fit. And it does specify, though, which is new this year and a part of this bill, some very specific uses of the fund. And again, the focus of these uses of the fund are really from hearing from all of you for years on how we can best both support and recruit folks into the early childhood care and education workforce. And secondly, what more we need to do to reduce costs for parents. So in the fund uses, it specifies that there is support for further childcare subsidies for parents. It specifies growing towards salary increases for educators. It specifies use of the fund for healthcare subsidies for early care educators. And it also specifies us being able to spend dollars to implement capital expenses for childcare facilities. Next slide. So let's dig into what it says about actual childcare provider rates. And again, a focus on increasing salaries. It requires the Office of Early Childhood to provide actual numbers on what it would actually cost to increase early childhood educator salaries according to the narrow cost study they already completed. And it recommends that those increases, again, are phased in to make sure that we are reaching those suggested rates to meet those salary increases. Next slide. It also requires that associated with these uses of the fund, that there is regular reporting that is provided to the Early Childhood Care and Education Fund Advisory Commission. That commission was established in law last year, and this bill reiterates that any uses of the fund have to be determined by that commission, who is also required to provide planning on what the uses of the dollars are and to hold a public hearing on the fund. Next slide. Regarding uses of the fund, the next piece is around healthcare subsidies. This piece is very much based on what has been implemented in Washington, D.C. to provide subsidies for early childhood care employers and for early childhood educators who employers don't currently offer health insurance. Both of these additional subsidies would be provided through the Access Health Connecticut Exchange. So working with some of the health plans that are already offered on the exchange, but providing further subsidy again to the employers or to the educators individually. This section in particular, we are working closely with Comptroller Scanlon's office, and this in language in the bill is pretty broad, but the Comptroller's office is working on more detailed language for us. Next slide. Next, in regards to how the fund would be used to further support and reduce costs for parents, there is an expansion of Care for Kids as a child care subsidy program, increasing the income eligibility to 85% for state median income. And there is a creation of prorated benefits up to 100% SMI to make sure that we're reducing any type of benefits cliff for parents, which is how it's structured currently as well. Next slide. Also in this bill, there's recognition of the great need to keep up with the capital expenses that folks may need to update facilities or create new facilities. That's why in the fund currently, there is the ability for fund dollars to be spent on the administrative or technical assistance costs of an entity to continue to implement these capital projects with facilities. So in the bill, it also references a bonding program, a continual bonding program over 5 years to give these dollars to make sure that these renovations and updates can continue to be made. Next slide. So again, this section reiterates the dollar amount. So it specifies that there would be up to $100 million in state bonds, and that's over a 5-year period for these facility grants. Next slide. The next section addresses the issue of presumptive eligibility for child care subsidies or care for kids. I know that this is a topic that you all may be familiar with, but this specifies in this bill that, again, all applicants, families who are applying to receive care for kids would receive a temporary 60-day assistance while their applications are being processed. Next slide. The bill also specifies a transition to prospective payment, which would be for care for kids providers. So it requires OEC to pay those providers in advance based on their expected enrollment rather than after services are provided. Next slide. Section 13 tries to address some of the concerns of private equity in the child care sector. It includes sections of a bill, both from Massachusetts and from Vermont. One piece of the bill limits large childcare providers, those with 10 plus locations, to a certain percentage of funds from the state. A second portion of this section addresses greater fiscal transparency from providers. I would say on both of these suggestions, really looking for feedback because there's only a couple states that have tried to address this issue. And we do want to make sure that we are serving and making sure that all of the current providers can keep providing care, but that we're mindful of the concerns around private equity buying into more of the Connecticut market. Next slide. We also, again, in section 14, have this related to this private equity language. It requires childcare providers to submit rates annually. And again, this is related to the language that Vermont had for greater transparency in the childcare sector to prevent significant increases, primarily with centers owned by private equity entities. Next slide. Section 15 addresses a way for us to get a better handle on our fiscal map of children's funding, children's and early childhood care funding in the state. This requires Office of Early Childhood to create a fiscal map of state funding for all of the early childhood care and education work with an entity called the Children's Funding Project. For those who aren't familiar, the Children's Funding Project will provide this free of charge to the state, but it would require OEC working with them directly to provide them all of the data. Next slide. There is in section 16 and the subsequent sections we're going to talk about a focus on several studies. Section 16 offers and requires a study on looking at liability insurance rates for childcare providers, and this would need to be completed with work between the Office of Early Childhood, the Insurance Department, and the Attorney General's office. Next section. This is another study related to looking closely at the low representation of men in the early childhood education sector and requires Office of Early Childhood to come up with recommendations for increasing male participation in the sector. The next section. Next slide. And then finally, the final study is a required report on the background check processing. It requires both Office of Early Childhood and DESP, who they work with on the law enforcement side to come together and look more closely at what is working and not working in the processing of background checks. We know we continue to hear from providers that this system is a barrier for hiring and retaining staff and making sure that their classrooms are covered. I also would say I did realize, and thank you to Vanessa for putting many of these slides together. I do have one other item that I wanted to mention that I realized was embedded in the section about increasing subsidies for parents for care for kids. So everyone knows one of the ideas that came forward to us and many other states are doing is for an ability for early childhood educators themselves to make sure that they have access to care for kids. And therefore, in the bill, there is not just inclusion of early childhood educators in being able to receive the care for kids subsidy, but it eliminates the family share fee for those families at those income levels. So it gives them a slight monetary benefit, again, for early childhood educators that might be able to, again, be eligible for care for kids. So I know that was a lot that we just went over, as you see from the slides, 18 sections. But again, I hope that it showcases a real kind of comprehensive look, not just at the investment that we need to start to make with having a recurring funding source for the Early Childhood Care and Education Fund, but that we're looking more closely at the uses of the fund to shore up the workforce and to support parents. And then finally, that this bill includes a number of policy areas that we've heard need to be further addressed within the childcare sector. So with that, I would love to stop there and just welcome your questions or, again, any questions or clarifications that I can make on what's currently in the bill.
Meryl, if I may.
Absolutely. Go
Thank
ahead,
you.
Adrian.
Thank you, Representative Farrar.
Yeah, nice to see you again.
Yes, it is. Not so much a question, but on behalf of the Family Child Care Providers Union, we just wanted to express our gratitude that in many conversations that we've had over many sessions, that the child care healthcare subsidy is something that is seen in a bill as important as 5003, as you mentioned. And so that is something that family child care providers have been advocating for quite a long time. Is access to affordable quality health insurance, and there are creative means of how that can be achieved. And so we're excited to see that that's one of the points that is being targeted here, along with other things like prospective payments and presumptive eligibility. Providers over the last decade have been asking for a reform that would allow for them to receive payment in advance rather than a whole month later. And so on behalf of the union, we want to express our gratitude that this has been addressed in the bill, and we'll definitely be there to support these aspects.
Thank you, Adrian.
Looks like John has his hand raised.
Hi,
Hi,
John.
Representative. Thank you so much. I really appreciate you spending the time to go over this plan.
Yeah,
I think it's just there's a lot of great things in here. Obviously, I've already shared with you our concerns about Section 13 and how that impacts WISE. But I just wanted to ask you, do you need a 60% vote from the legislature to, because the funds are not are how do I say this? To override the fiscal guardrail plan law, or does it just need a majority vote?
yeah. So this doesn't change the guardrail, right? There's nothing in this bill that seeks to adjust the guardrails. It simply indicates that there are dollars that are moved into this fund. And from my understanding, there's been a number of funds over the years that have been outside and then back inside the spending cap, outside, then back inside the spending cap. So from my understanding, there hasn't been an indication that this would be perceived as needing, as being perceived as, again, being something that would break the current guardrails as they're written in law
Okay, thank you.
and require an additional vote.
Thanks,
So-
John. Oh, do you see the question in the chat, Meryl?
I see a question about section 7 asking about would the waiver of family fees for early educators using Care for Kids apply to family child care providers? It would. However, there is also a prohibition on providers taking care of their own children. So you could swap kids with a family child care provider across the street, but you probably can't get paid by Care for Kids to take care of your own
Your
children.
own kids, yeah.
Yeah.
Thank you for that, Meryl, for clarifying.
Any other questions? You
I
can put
do
them in
have
the
a
chat.
question, but I cannot find the hand raise on my Zoom.
That's
I think
okay, Georgia, go ahead.
So, and I know this is not a debate. We were counseled that it's not a debate, but it was something that one second.
While Georgia is.
I'm sorry about that.
We got you,
At the
Georgia.
child
We're
care
here.
center, and
We're
I'm
here.
getting cupcakes, so that's important. Or I guess I'm not getting cupcake.
Now we have cupcakes on the brain. All we want are
Oh,
cupcakes now,
yeah,
Georgia.
so it's a presumptive eligibility, and I raised this only because my concern for families and for childcare providers, more specifically family childcare providers, is if we bring a family in, and we've been kind of seeing this on the ground, parents submit their application and then they don't get approved for Care for Kids because they think income-wise they're eligible, but then they're not. And especially families in mixed immigration status, or a family who may not be able to get an employer to submit documentation of employment, or some families who are self-employed they think that they're eligible, but because of how self-employment is calculated for Care for Kids, they're ineligible for the program. And so I just wanted to just raise a concern about somebody being brought into Care for Kids, brought in through the Care for Kids program. They're occupying a space at a childcare facility, and then they find out 3 months later that you cannot, that you don't qualify for the program. I'm just worried about the disruption of care for those families, because a lot of those families are not going to be able to remain at that childcare facility. And I am worried about what it would also mean with the disruption of income for family childcare providers, who then are going to make a decision that should I keep this family and not take as much money from this family, or should I just tell this family that they cannot stay here? So with a presumptive eligibility, that is the flag that's sort of like, the horn that's blaring at me, that on the ground in practice, it's going to, I hate to think of a little baby that's come in and 2 or 3 months later, where we are, as a childcare provider, kicking this family out of the center because they no longer have Care for Kids. I just hate what that does to that family and that child psychologically.
So what they did in Maryland was to put in a screening tool that, based on the experience of which families actually get approved, that they can screen out like 95, 98% of the people who wouldn't be approved, and then offer the presumptive eligibility to the folks who are very likely to get approved eventually. And it's to eliminate the delay that we have with people, waiting for a long time thinking that they might get care for kids when they were clearly not eligible, and B, the folks who really need care, who are eligible, not being able to start care because there's a paperwork processing problem.
Yeah. Again, I've been doing this for 20 years now. Next week is my anniversary, my 20-year anniversary. And I cannot tell you how many times we have been stuck holding the bag with families who think that they are eligible for the program, but during that approval process, something is missed, and those families are then ineligible for the program. So I really just want to raise that as an on-the-ground potential issue with this. And I'm very worried with the family childcare providers, because I know from our network that our family childcare providers step in those gaps. And we do have some family childcare providers that have EC early start funding that can help them to step into those gaps. But many times it's the most vulnerable providers supporting the most vulnerable families. And we saw when the Care for Kids program went to a waiting list that many of those families stepped in a gap. One of my providers on the call, she can affirm. And when we could not step into the gap, we had children who had to be American children, and Beth did share this at the Blue Ribbon panel, had to go to a different country to get care. And so again, if we then layer on top of that the hope that this parent is going to get care for kids, and then rip away that hope and then rip away that care from that family, I'm just really worried about the underground application of this.
Thank you, Georgia. And Meryl, I don't know if you'd be willing to share with me, but I don't know if others would be interested. I know you mentioned Maryland had done this, and I don't know if there's a way for us to look more closely at their implementation, but I'm sure that would be helpful for me and potentially others. So if you have any more info, please
Okay.
share it.
Yep, I'll get
Thank
you that.
you. Yeah, thank you.
I know that there are various people who come at this from different perspectives. There, I think, are some folks who were lucky enough to get a grant to do renovation, who want to support the bonding and the support for facilities. I know that there are folks here who rely on Care for Kids as their bread and butter, all the family child care providers. So at some point, Vanessa is going to share the set of talking points. Nobody should feel obliged to use all of them. Pick the ones that relate to you and share your experience about why we need to make changes to the system and mostly get more money into the system. What other kinds of questions do people have?
Hi, Representative Farrar, Meryl and Vanessa, thank you for putting together this clean, easy to understand presentation. For the healthcare subsidies, can you refresh me on, what portion will it be covering of the health insurance costs, and is it open to all or certain income brackets?
What a great question, Louise. And I wish I could answer your question in full, but the way the language is written now and is in a very broad way to really indicate that we want to develop said program that I said that provides subsidies for early childhood care and education providers and individuals. We don't specify yet in the bill the amount in full dedicated to this support or the levels, because again, we're waiting and working on with the comptroller on some modeling of how that could look. As I shared, Washington, D.C. pursued this recently, and they did invest approximately, I want to say about $12 million in this effort. And obviously they were able to get, hundreds and hundreds of more educators and also employers onto the exchange. But in the bill right now, as it's written, there are not any of those details because we are still trying to work out how this could look for Connecticut. But I welcome, I hope, hopefully in your testimony, you certainly, if you have particular recommendations, please feel free to provide those.
Thank you so much.
Yeah.
And Georgia in the chat has asked, would the tuition disclosure apply to all childcare settings, including private non-state funded providers?
Let me look. Right now, because I believe that would be section 14, it does require all facilities registered, quote, registered in the state to annually report their tuition rates to the OEC. And that was based on what Vermont did to try to provide more transparency in the system. But again, welcome folks' feedback on that in your testimony for sure, because we are trying to share what Vermont and then again what Massachusetts did to try to address private equity investment in the childcare sector.
Oh, Sky, you got your hand raised?
Oh, hi. Yes, I just had another question. Thank you, Representative Farrar.
Yeah.
And thank you, Vanessa and Meryl, for these talking points. I think it's so clear what is included here. Given the incredible need in the state for infant toddler care, and I apologize, I did join late from another meeting, so if this was covered, I can watch the I can watch the recording. But given that incredible need, and it's the area that we know is the most expensive, how do you see this bill kind of directly addressing that particular need? Especially, it's not in the governor's proposal as much as far as that expansion.
Yeah, great question. And I'm happy to reiterate it because I think it's worth saying. We did talk about it a little bit at the beginning, but what I would say, as you said, the governor's proposal, I think, outwardly focuses more on fulfilling more pre-K spots in the state. As you said, I think in our thought process about putting together this House Priority Bill 5003, we wanted to put more attention on the needs in the infant toddler care system. And what I think you'll see to try to address some of what we've heard are the greatest needs are, number one, how we retain and recruit and support the educators, right? And that's why the bill includes addressing wages and also includes addressing health insurance subsidies for early childhood educators. And then thirdly, in regards to bringing down parent costs, it tries to address some of those infant toddler costs for parents by increasing the subsidy support within Care for Kids and expanding that for parents, as well as supporting early childhood educators to receive Care for Kids and not have to pay the family share fee within Care for Kids if they qualify. So again, I think it tries to dig in deeper to some of the needs within the infant toddler space that were highlighted in the Blue Ribbon Commission work. And it tries to kind of lift those up in a deeper way that you might not have seen in the governor's bill. But I think it tries to kind of move us in the direction of needing to do more and make more of that investment in those infant toddler needs. So I hope that's helpful to kind of distinguish them and kind of where this bill focuses more on.
Thank you. And it looks like John Catalan is asking, will all childcare staff be eligible for the staff investments?
And just to clarify with John, John, what do you mean by staff investments?
The salary enhancements, basically.
Yeah.
We do have a lot of Ys that, not a lot, but we do have some Ys that don't have care for kids in school readiness. So I just want to make sure that all the staff are going to be eligible for the salary enhancements.
Yeah, great question. So in the bill as written right now, it is focused on the Care for Kids provider payment rates, especially kind of building off of the narrow cost analysis. But I would also say that I know that the Children's Committee did have a bill on pay in a few other places. There is a standalone pay for provider rate bill. And then just yesterday, there was another bill that tried to address provider pay. So I think your feedback on how we progress with provider pay is not just provider rates, but educator pay is more than welcome. But in the bill right now, it kind of addresses the need to cost out what the salary increases would cost.
Okay.
And it requests them to report to us on that so we can start to phase those in. The health insurance assistance program would be for everyone. I want to be clear. There's not a distinction in regards to that piece.
I mean, obviously, I'm sorry to hog time here. Just a
That's
follow
okay.
up, just a follow up comment. Obviously, our concern is if the childcare workers working it that are in unsubsidized programs will all leave if they could go make a higher salary at a subsidized program, and then obviously we would still continue to. Yeah, I don't. This is more an anecdotal thought, but I just wanted to raise that. Thank you.
I appreciate it.
Don't all jump up at once. We've got some more time left. We're very lucky to have Rep Farrar here, so let's give her all of our questions now and not bombard her with emails later.
Apologies again that I have to turn my mic on.
That's okay, go ahead.
But I did have a question about the Connecticut, is it funding project?
Children's funding
Children's
project.
funding
Yeah.
project. So I did read that this work would occur under the condition that it were free.
Yeah.
And that if there was a charge, that the work, that would preclude OEC from entering into this work.
Yes.
So what if they do come with a charge and then that work doesn't move forward as a result of the charge? Is there a plan B for how we look at this data? I guess is my question.
Oh, great question. I would say that language is really in there because we didn't want there to be a fiscal note when this bill does go for a fiscal note. We didn't want it to signal that this component of the bill would require any sort of state funds. So that's why that is noted there. Again, in my awareness of, chatting with the work of the Children's Funding Project in every other state they've worked in, it's free. So I don't perceive that changing. That language is there because on the back end, as this bill goes through its process, we didn't want the Office of Fiscal Analysis to think that there would be any sort of underlying cost to the state for that.
Okay, thank you.
Yeah, of course.
I do want to make and I will be, I guess I agreed to be at the press conference. So one of the things I have to share with you, Rep Farrar, as I'm reading this bill that jumped out at me, is the family fee portion for the for the child care providers. And that has a particular, it resonates with me because during the pandemic, one of my staff person, while she was here working during the pandemic, taking care of other people's children, she wasn't eligible for the Care for Kids program, so she could not afford to bring her child to our center. And I think, again, there's so many, I'm sure, of those other stories of teachers who are caring for other people's children while their children are very vulnerable. And I think I wish we could make it that if you work in childcare and you have children, that would be a presumptive eligibility for you. But I'm okay with this first step. I know a lot of childcare centers have started to make their tuition free for their staff. I know it's something that we did immediately after that. So I just wanted to lift that up to you because I plan to lift that up, the importance of that for families. So I just want to just
Thank you for
tell
sharing
you
that.
how important that aspect of the proposal is, and just to thank you for hearing all of our input over the years and adding this, making sure that these things are in a bill.
Thank you, Georgia. Yes, as you said, you're not alone in acknowledging that so many individuals, as you said, like the individual who works with you, was understandably struggling with care for their own kids, and we need to do something about that. And I hope that, especially in looking at how we could structure this in somewhat of a seamless way, this kind of allows, the care for kids requirements to stay the same for everyone, but it at least provides that slight financial relief by ensuring that the educators wouldn't have to pay the family share. So we hope that it's a little easier on the administrative side as well.
Would
Thank
Care for Kids, I'm sorry, would Care for Kids cover the balance of that, or would it just be that Care for Kids would have a zero family fee? And the example of that would be like if I charge $400 and Care for Kids covers 370,000, and then come back and say we're going to cover $340 and the family fee would be zero. Are we saying that Care for Kids is going to just zero out the family fee, or are they going to cover the full cost of care for that certificate?
The way it's written is that it would that the 7% family share for the educators would be covered. So, folks have to qualify for the Care for Kids program, but those educators, they would have, basically how it's written is there'd be a waiver for them out of that family share. I don't know if that helps clarify it or not, or you're thinking through how the different payments would work on the back end.
So we would have to get some clarity around the fact that whether it is that Care for Kids is going to be covering the full value of the certificate,
Yep.
because simply waiving the family fee doesn't then say that the family portion doesn't necessarily make clear that Care for Kids should be covering the full value of the certificate. And so we don't want to also have our good be
You
evil
don't want to be on the
spoken.
hook. Yeah, I
Right.
understand. Yeah, we
Right.
will. I appreciate that. And I just made a note to myself to make sure that as we look at how that's specified, that it's more explicit about how that flow of payment is happening if we need to do that.
The bill does call for OEC to come back with a report on how much it would cost to raise rates so that you could get wages up to higher levels. And so it doesn't say in this year we're going to raise it by this amount. That's sort of the direction that you're trying to go with this bill, right?
Yeah, but I was just clarifying for Georgia in regards to for the educators and getting that additional benefit for them under Care for Kids, how to make sure that the provider isn't left in the lurch for that family share component, that it's clear that, right? That's what you're
So
saying, that they're getting the full amount from the state.
So you could have a program that charges $400 and Care for Kids says we pay $350.
Yeah.
And then because there's a parent share, they really pay 300, the family pays 50, and then
Yeah.
there's still another 50 over. Yeah.
Yeah.
Okay, we have a question from the chat from Clarabelle. I'm going to ask her to unmute now. Sorry if I didn't pronounce your name correctly.
Yes, that is correct. Good afternoon, everyone. Hello, Ms. Farrar.
Nice
I
to
just,
meet you, Clarabelle.
you're welcome. I just want to make sure, I know it's not a debate or anything. In that bill that you guys presented, is professional development for the providers and for the people who work in the early childhood education will be also, you guys will be considering to invest money for us to go ahead and take training and go to class. That way we can be able to get more knowledge on how to work around our kids.
Thank you, Clarabelle, for that question. I will say that in this bill, at this moment in time, 5003, there is not a particular call out to professional development because I do believe that that continues to be included in the Office of Early Childhood budget. I don't know, Meryl, if that's something you could address or know more about in regards to the inclusion in the Office of Early Childhood budget for that outside of this bill.
I know that there is some money in OEC's budget. I know there's also some professional development in the union contract. Is that right?
Yeah, that's right. And so it is $250,000 per year, according to the union contract. That fund does roll over. The fund is available to providers who provide care on Care for Kids. You do not need to be a union member in order to access those funds, but you do have to have a child or a Care for Kids certificate or a child that is receiving the Care for Kids subsidy program. Additionally, the funding could be used for achieving first aid, CPR, medication administration, some of the 8 hours of courses that are required. And Claribel, I'd be more than happy to speak with you later. I sent a message in the chat, and we'll go ahead and connect with you after this so that we can get you a little bit more information about the benefits in your union contract.
Okay, perfect. I have another question as well. Ms. Farrar, do you guys also will be covering about the subsidized program for the food or no?
Can you repeat that, Clarabelle? Were you asking about food subsidies?
The food subsidy program that we are receiving. For example, right now we are the food that we purchase for the children. Everybody in different section of Connecticut, we participate in different program for the food. Would that bill would be also part of your proposal or no?
Great question. It is not in here as it exists now, but I would love to hear more about this. And again, I don't know if Meryl or Adrian can clue us into what Clarabelle might be speaking to.
So there are two issues there. First, in Senate Bill 6, there's reference to moving the child and adult nutrition or health, CACFP. I don't remember what the initials stand for. Moving that from the Department of Education to the Office of Early Childhood. I know that OEC is like, wait a moment, we don't know anything about this. Why are you giving it to us? But the bigger issue is what's going on with the congressional budget process and the cuts that they appear to be ready to make to SNAP and other nutrition programs, as well as Medicaid. And so I think, yeah, we would like to hear more about your question and see if there's a way we could address it in one of these bills, but it's not there now. Yeah.
Okay, thank you for the clarification.
Thanks.
Clarabelle, please follow up certainly with Meryl and Vanessa if there's something you're struggling with immediately, so we can make sure that we try to address it.
Okay, thank you so much.
Thank you.
Okay, I'm not seeing any other questions, so I'm going to share one last slide, or actually two other slides. This first one has the hearing information. Meryl, if you'd like to go, or Meryl and Representative Farrar, if you'd like to go through all of that.
Okay.
Sure, I can start and then Meryl can go to the public hearing. So we welcome all of you if you're available and excited to show just your passion and support for these essential investments in early childhood to join us for an 11 a.m. press conference. This is going to be in room 2E in the Legislative Building. And this press conference is hosted by myself and the Speaker of the House, Matt Ritter, again, in recognition of this being a priority of our House and our House Democrats. So we welcome all of you, and we would just love to have you there and hope that that can kick off your day in engaging in this important issue. But I'll let Meryl go through more of the details of the public hearing. Thanks, Meryl.
Okay. So with the public hearing, there are two ways you can participate. One way is to submit written testimony, which I hope all of you will do. The second is to sign up and testify. You can testify for 3 minutes, either on Zoom or coming up to the Capitol. If you were coming up for the press conference and you thought you might be able to stay, sign up to say you would do it in person. If you know that you're going to do it remotely, sign up to do it remotely. The way this works is that everybody has to sign up before 3 p.m. on Monday. And then at 6 o'clock, they will publish the list of the order that people will speak. That's always done just as a random draw. So you never know whether, it's not a matter of if you sign up today, you'll get top of the list. And then when it's your turn to testify, your name will get called, and you will have 3 minutes to tell the committee why you support the bill, or what your opinion is about the bill. If there are particular things that you think are really important, talk about those. These are always best if you talk about things from your personal perspective, how it impacts you. And we have a set of talking points that I think Vanessa has shared in the chat. I'm not sure.
Yep, it's in the chat, and I'll send it again.
And it'll all get sent out to you. But so the first step is to, if you think there's a chance you can testify, either on Zoom or in person, to sign up to testify, because you need to do that before 3 p.m. And then the next piece is to write some testimony. If I am writing testimony, I know that I can get through about 1.25 pages in 3 minutes, if I were to read it. But that doesn't mean that you have to limit yourself to that. Just that if you're going to testify in person or on Zoom, and you're going to use a guideline of like, how much can I say in 3 minutes? That's about it. You could certainly submit longer testimony. The fact that we now have electronic testimony as opposed to paper testimony means that you can include links. You can put pictures in. If you want to tell everybody how important the financing for the grant money to renovate your facility or build a new facility was, and you want to show before and after pictures, you can put those into your testimony. If you want to relate a story from a parent about how important it was for them to get care for kids, all of that you can do in your testimony. And I think we should probably go through the tool that you've got, Vanessa, of sort of testimony, how to write testimony, and the tips, the talking points. Can you share your can you do that?
Yes, give me 1 second.
Okay.
Can everybody see this? I'm going to try to make
I
it
would
bigger.
say, before we really dig into this, if anybody's got any more questions for Representative Farrar, let's not waste the opportunity to ask her. So
Yes.
if you've got any questions.
I'm not going anywhere. You all know how to find me, so all good.
I see
Meryl,
a-
I don't, it's Mary. I don't have a question, but
Hey,
Edie and I
Mary.
both, hi, how are you?
Nice to see you again.
You too. Edie and I both put in their scholarships through Connecticut Charts of Course.
Yeah.
That people can get. So I just wanted them to know that those scholarships are available there.
Okay. All right. So let's go through the talking points here and the testimony right tool.
Sure. So I'm just going to give a quick tour unless, Meryl, there's something you want me more specific you want me to go through.
No, I think where's the
Okay, great. Okay. Tell me if that's not big enough.
that's make it bigger.
Okay. I don't want to give anybody
That's much better.
the spell. Okay. So here at the top, you've got your instructions on how to use the guide. This here is a link to the bill itself. So you can pull direct language from it if you'd like to. This is a link that is the slide presentation that you just saw. And then as soon as we have the recording available for this meeting, I'm going to add a link to that here as well. So check back to see if that's been updated. Here under hearing logistics, you can see you can click on the agenda to see the other bills and that all the information about the hearing itself. And then here's a link to watch online. You've got links to register to speak, submitting your written testimony. And this is a link here. This discusses a sign up form to let us know if you are planning on if you're planning on submitting testimony or speaking in person, excuse me, you can click this link here and it'll take you to a form where you can let us know that you're testifying or submitting testimony, because we do keep track of all of that information, who is testifying from our networks. And then if you'd like, you can also indicate that you want us to update you on your place in the speaker order if you're testifying verbally. We can do that for you. We just need your email address, or I'm sorry, your phone number. And then I think, please, Jennifer or Adrian, correct me if I'm wrong, but I believe if you're a member of the union, you can contact Adrian or Jennifer and they can help you get all set up and everything. John, I see your question in the chat. Yes, we are going to send all of this to everybody via email. Don't worry. And Karina, it will be sent in Spanish as well. If you scroll up in the chat, it should be available in Spanish. The slides have a Meryl and my contact information if you have any questions or concerns. This page is just information on constructing your testimony. Keep it loose, guys. Nobody's going to grade it. And then here down on page 4 is where the actual talking points start. You've got another link to the slides if they are helpful. And then I'll be adding the link to the recording here as well. These are just some brief bullet points. Use as many of them or as few of them if you'd like. The most important part is to include your personal story in what you're saying. So I've pre-filled some of the information here for you. I've got the bill name and number. Every time you see brackets here, that's a place where you need to insert your own information. Okay. So you're going to want to put your name, list your town. If you are a constituent of any of these people or anyone who's on the Children's Committee, it's helpful for them to know that. And then you can say, I am the manager of membership and advocacy for the Connecticut Early Childhood Alliance, for example. Or you could say, I'm a mom, I'm a childcare provider. Basically, here's why you should care about what I have to say about this. This is the experience and the perspective that I'm bringing to the table. We would love it if you said, I am testifying as a member or a supporter of the Early Childhood Alliance. That would be great. And then this is just a generic, these are some of the good things that this bill does. And then here's where we would love it for you to spend the most time. You can tailor those talking points to your specific experiences. Meryl made some really good points about how the story is most impactful. These people here data and statistics and people talking at them with boring things all day long. But if you tell them a story that they can remember, that's going to resonate and it's going to be impactful. Not that data is not impactful, but they go hand in hand, and the story is the way to back it up. And that's the end. So if you have any questions on that, I'm going to switch back to my presentation. Here is our contact information. If you have any questions about the bill itself, contact Meryl or Representative Farrar. But I can help you with anything regarding logistics about getting to the Capitol or using any of the resources that we shared with you. Or if you need help signing up or submitting your testimony, I can help with all of those things. But Meryl is the policy guy that you want to talk to. And I think that's it. Meryl, did you have anything else?
I just want to thank everybody for spending an hour with us hearing about this bill. And I hope that you can all write testimony, testify at the hearing. And if you are able to make it to Hartford and come for the press conference, that would be great too.
Wonderful. Thank you all so much for sticking with us. And we will get this recording sent out to you to the email address that you registered with. Thank you so much. Have a great rest of everyone's day. Bye-bye.